Hi, I'm Dr. Yvette Lu, and today we're going to talk about the risk associated with the inhalation of wildfire smoke. Over the last few days, we've had increasing amount of wildfire smoke in our area. This can be risky because of the particulate matter in wildfire smoke, which we can inhale in our nose and mouth, and which can go deep into our lungs and aggravate our lungs. And it can be especially problematic for people with chronic disease. The people at highest risk from wildfire smoke are children because they inhale a large amount of smoke relative to their body mass index. Older adults, because they're at increased risk of chronic diseases, especially heart diseases and lung diseases, and of course, people with chronic diseases like respiratory diseases and heart diseases, including asthma, chronic obstructive pulmonary disease, emphysema, bronchitis, heart disease, coronary artery disease, heart failure, and people who have diabetes because they are at higher risk of having heart disease, and pregnant women because we don't know the effect that smoke will have on a pregnancy and on the developing fetus. Some of the symptoms of smoke inhalation include runny nose, stuffy nose, sore throat, shortness of breath, difficulty breathing, cough, wheezing. Now, as you can see, some of those symptoms overlap with the symptoms of COVID-19, so there can be some confusion. However, some of the viral symptoms that you get with COVID-19 you will not see with wildfire smoke inhalation. For example, a fever, chills, muscle aches and pains. Those tend to be associated more with viral infections. However, if you're not sure or if you have significant symptoms, it's important to seek medical attention. What can you do to reduce your risk of wildfire smoke inhalation? First of all, you want to stay indoors as much as possible. Avoid outdoor activity, especially strenuous outdoor physical activity. When you're inside, close all your doors and close your windows in your car, close your doors and windows. Now the risk is right now we're in summertime and it can be quite hot. So if you do close all your doors and windows, please make sure that you don't overheat because you can be at risk of heat exhaustion and heat stroke. So if your home is very warm or your car is very warm because you've closed all your doors and windows, it's important to go somewhere else where it's cooler. Find somewhere that has an air conditioner, maybe a public space, but make sure you stay physically distanced while you're there. You can also get an air filter for your home, and that can help filter out small particulate matter, but make sure you don't get one that produces ozone because that will increase the pollution, the indoor pollution in your home. Other things that can increase the indoor pollution levels in your home include cooking food. So you want to try to reduce cooking as much as possible, using a gas stove, frying food, broiling food. This can all increase indoor pollutants in your home. Vacuuming can stir up pollutants that have settled in your home, so you want to avoid vacuuming, and then avoid even using candles, using your fireplace, burning wood of any sort. Avoid all that while the smoke levels are high outside. A good way to tell how high the smoke levels are outside is to look at the air quality index. And it's a scale from 1 to 10. If the air quality index is 10, that means that the air quality is very bad. It means that the smoke levels are very high in the air. So right now today, the levels are 10 plus. So that's pretty bad. So today is a good day to stay indoors. A lot of people are wondering if the cloth masks we wear for the COVID-19 pandemic are also protective for wildfire smoke. These masks aren't that great because they do let in very small particles. However, they may be better than nothing. So what you can do is make sure you have a very, very close-fitting mask that seals tightly over your nose and under your chin and around your mouth. And make sure you have at least 2 to 3 layers with your cloth mask. A better solution, one that would be much more effective, would be to use an N95 mask that is well-fitting. However, those are hard to find right now because of the pandemic. The most important thing to remember is to stay indoors as much as possible and to seek medical attention if you have any symptoms. And of course, if you do have respiratory illness, to carry your puffers and your medications with you at all times. Take care.